Welcome. We are live streaming right now through YouTube. I want to say hello to everyone out there. I hope you're having a pleasant day or night, depending upon where you are in the world right now. I'm Dr. Mandell. Today I'm going to talk about something very important. I want to talk about occipital neuralgia, headaches, conditions or problems that stem underneath the back of the skull that go over the head behind the eyes. This is such a common condition, and primarily the topic here is painful neck conditions, occipital neuralgia, when looking down on your smartphone. Okay, here's my smartphone, and obviously very few of us look at our smartphone in front of us like this. We spend a lot of our time in this particular position, not only you, but children, teenagers, even the elderly, and it does affect the spine tremendously. A lot of these conditions, like common headaches that go over the head behind the eyes, I want to show you a little bit so you can understand where I'm coming from, what I'm trying to get across, because I'm getting lots of emails and lots of questions about constant headaches, about poor posture, about reversal of the normal curve. Let's look at this right here. We can see that this is a common epidemic. We can also see that the head weighs 12 pounds, and for every inch we go forward, it's an additional 10 pounds. But this is, I just want to show you the amount of degrees of going down all the way to the edge of this on the right side, as this man is looking down 60 degrees, and that 60 degrees is like carrying a 12-year-old kid. But imagine those muscles, ligaments, and bones trying to hold up the weight of the head, because the more forward the head goes, the more stress you're going to feel, and the more irritation that you're going to get on the nerves that's going to affect those ligaments, as well as the disc, which can cause herniated disc, bulging disc, and disc degeneration. If you look at here, here's a normal curve and a reverse curve. Many people ask me, I have a reverse curve. My doctor, my chiropractor says that my curve is the other way, and they want me to come in for all these visits. What am I supposed to do? Well, I want to just let you know that I'm going to pull a spine up, and the same position that we're looking at it. Now I'm in the camera, so I'm going to go the opposite way so we can kind of get the same position we're trying to achieve here, because as I look at the camera, basically you can see that this is a normal C-shaped curve, and as the curve becomes the other way, it starts to reverse. Now if you look in between here, you see the discs in the front of the vertebra. You have the yellow nerves, which is part of the spinal nerves that connect to the spine, and they control what goes down into the shoulder, arm, and hand, the chest, the mid-back. Now underneath the back of the skull, you have occipital nerves. But let's go back to this particular view right here, and we can see that these nerves under the skull, they go over the head behind the eyes. So those people who are experiencing headaches, heaviness in the back of the eyes, maybe some visual changes, or maybe just pressure up in here, instead of just getting into the habit of trying to just treat those symptoms, you need to look for the source. The first thing I would tell you to do is put an ice pack under the back of the skull, and if your symptoms start to feel good by putting an ice pack under the back of the skull, then you might have hit the target. Then you know it's coming from nerves underneath the back of the skull. Greater occipital nerve affects all the way over the eyes, over the head behind the eyes, and is very, very common. So remember, when this curve goes forward, the weight of the head being 12 pounds is putting excessive load, okay, on that particular, on the discs, stretching the ligaments, causing the disc to become weaker, making it more susceptible to bulge, to herniate, or actually cause degeneration. Now remember, degeneration is all about imbalance. If it's your knees, if it's your hips, or the neck, we can't afford the neck, because as these discs get degenerated and as they get smaller, that means that the space where the nerves come out of here becomes smaller, and we have more of a tendency to become more of a pinching or of a compressed nerve. So I wanted to bring that out to you, very important. Now if you look here, these suboccipital muscles, when going forward, those muscles are under a lot of stress, a lot of strain. You then get inflammation. We have other muscles in the posterior neck muscles that are under a tremendous amount of stress. We look at the splenius capitis muscles, levator scapula muscles. We look at the upper trap muscles, the occipitalis muscles. And so we're getting that whole stretching type of mechanism causing irritation, fanning the vertebrae out and putting lots of pressure behind the skull. But just remember that, you know, the normal curve, if you look here, the normal curve, if you look to the left, it should be a normal C-shaped curve. And as we're looking down like this, as the spine shows us, as I just showed you on the vertebrae model, look what's happening here. Wow, that's a tremendous amount of load. We're compressing the forward part of the vertebrae. The back part of the vertebrae is starting to fan open, and we're putting excessive stress because all those muscles back in here have to stretch. Now, dynamically, let me explain what happens here. As the curve here, which is normal, okay, let's just show you in this position. So let's do it this way. So when the curve is normal, and a normal C-shaped curve, and that curve starts to stretch forward like this, as you see in the other diagram, what's happening is if you look at the space between the top vertebrae and the seventh vertebrae, and let's say it's point A to point B, okay? Now, when that curve starts to bend forward in forward head posture, this curve becomes stretched. So now it's like point A to point C. So instead of it being from here to here, now we're from here to here. So therefore, when that curve gets stretched, those muscles are becoming stretched. So when those muscles get stretched, it becomes a very painful condition, a stressful condition. They become weaker, the nerves become irritated, the muscles start to spasm. You get a whole vicious cycle. A little tip I want to bring out to you, what can you do? A little exercise I want to show you. I think it's a great little exercise. Fast 20 seconds. I'd like you just to take your hand in front of your head like this and just push up against your hand for 5 seconds. Okay, take it behind your head, grasp your fingers together and push back for like 5 seconds. Don't move your head, just contract back. Then you're going to go to the left side, okay, 5 seconds, and the right side, 5 seconds. And what we're doing is we're resetting the muscle spindles in the neck that when you start to go forward, the load of those muscles are not going to give way so easy. To start doing a little resistive isometric exercise, I think it's a good thing to do. The most important thing you need to start doing is looking down from the chin, okay? Because the more forward your ears go in front of your shoulders, looking it from the side view like this, okay, the more stress that these muscles and ligaments and tendons have to hold up. And most important, this particular area, the occipital nerve roots, become inflamed and irritated. Occipital neuralgia, cervical cranial syndrome. These areas become extremely inflamed. Use ice initially. I think that would help you. But most important, watch your good posture. I invite people out there to go through my videos. I have many videos out there on forward head posture, self-help exercises, things you need to do to make sure you really work on that good posture, because that is your future. I promise you one thing. If you take the time, the small little bit of time, and be more oriented of your posture, particularly while driving, sitting on a computer, looking down, texting, whatever you're doing, you're going to reap the rewards in the future. If you don't take the time and you are careless, you continue to be in this position, you will have 10, 20 times expedited amount of degeneration as what you should normally have. You can't afford to degenerate the neck, otherwise it's going to give you lots of potential problems in the future. So I hope this was worthy to you. I hope this gave you a little bit of advice. Just a reminder, these little things are really good. It actually reminds myself. I ask you to share these videos with others. And most important, everyone, thank you, chat room out there. I appreciate you coming in and tuning in with us and sharing your time. I understand your time is valuable. I thank you very much, and God bless you, your families. And most important to everyone out there, I want to let people know, Motivational Doc on Facebook. Go ahead and like the page. Come over to that page. You can leave your questions there for me. They're a lot easier for me to get to. Most important, have a great day. Take care now.